In 2008, St. Michael's Hospital recognized that there was a need to do something different to improve how our patients move through the hospital system. We decided to focus on building capacity for improvement within our organization. And this strategy was fundamentally based on marrying the principles of quality and quality improvement, performance feedback, and organizational learning.
At St. Michael's Hospital, we've used the Institute for Healthcare Improvement's definition of quality, which has 6 dimensions. And what I tell the staff is that we need to be excellent at all of those if we're going to be an excellent place to be a patient.
It's that concept that we look at the whole continuum. We are looking not only at just our intake, but what are in place and what are the processes, and we know we can do better. And we've had lots of help in order to provide us with some tools and resources to improve that process, and I think it's just taking that whole bigger picture.
Right from the beginning, our whole process has been looking at how to redesign the way in which patients get their healthcare through St. Michael's Hospital. This has meant bringing together interprofessional teams which included doctors together in action groups where the intention is to focus around patient-based activity.
I think what we're seeing here is really fundamental change in patient care, and it is energizing because at the end of the day everybody wants to do a better job. And unfortunately, I think in the last few years as healthcare providers, we've just been asking people to run harder and faster and do more. And not only is that unsustainable, but it's not really a very smart way to do business. So that's the thing that's exciting.
When you talk to all the physicians, we all have the same ideals, and we still want the best for patient care. I think standardized approach to patient care, working across services and also creating a multidisciplinary team for managing those patients will result in the flow and the outcomes that we really need for our patients.
And people are starting to now work together at all levels, from the physician engagement, from nursing, through to the paramedical staff, the housekeeping staff.
We're supporting the patient, providing still the care they need, but also looking at efficiencies in the organization so that our patients can actually get through the system a little quicker.
What has been really a pleasant surprise is to communicate with the other floors. We have a cluster meeting every morning and every afternoon, and it's good to put faces to the people that you interact with.
It's nice that we're not surprised like we used to be. At least now it's planned. We actually get the equipment ready prior to the patient showing up, and things run a little bit more smoothly.
It really is about attention to detail around transfer of care, around handoffs, around communication, making sure all those things work better. So the challenge is, how do we provide better care when they're an inpatient, and then better discharge planning so their care is better downstream.
You try and look for strategies within your own unit or locally, and help from corporate flow has been really beneficial to that.
Our goal is to get patients to the right place at the right time. The hospital acknowledging programs or floors that are doing well with before 11 discharge or discharge prediction accuracy, celebrating their success, that brings it down to the frontline staff, and that's appreciated.
Everything we do, we've got results to show where the improvements have been. What this is equated to for a patient who gets admitted through the emergency at St. Michael's is that they're now spending half the amount of time they would have spent back in April 2008 for the bed to be available within the hospital.
And so now, as a physician, I can see a patient in the emergency department, and I feel like I can honestly say you will probably be admitted to a ward within a few hours. And that's nice. I know the patient is getting good care, the patients are less upset.
It's really fantastic to see everyone rally together to accommodate our needs and emerge, and I know that our staff are probably happier than they were before we had cluster meetings and before we had such a patient flow focus.
What we focused on at St. Michael's is not the individual numbers, but on how we can improve patient flow everywhere in the hospital, and that's been quite a remarkable journey.
I'm particularly proud of the corporate patient flow performance team, but also the teams across our hospitals that have really rallied together to set the strategy apart from others that we've tried before. I believe we have the foundational principles on which to really catapult St. Mike's to a different level of performance in the years to come. And I believe that quality improvement is the anchor on which we will be able to achieve this.
Well, I couldn't be more delighted and proud of the St. Michael's team getting this award. It's absolutely well deserved. They've worked very hard against odds in many cases, to do something that has really begun to transform our whole hospital.